Welcome to the Business Spotlight Series. My name is Steve Chiama. I'm the franchise owner for Action Coach in Fairfax, Virginia, and I'm your host today of the Business Spotlight podcast. Today, I have the pleasure to introduce Irving Weinberg, the president of Weinberg Medical Physics Incorporated, as my guest. Today, we're going to talk about Irving's business, share his journey into business ownership, challenges, best practices, and share a peek of what it's really like to build and operate a business. So if this is your first time on the channel, be sure to like and subscribe to get notifications when a new show like this one is published. Irving, welcome to the show, and thank you for being here today. Please, if you would, share a little bit about your business, who you are, and tell us a little bit about what's going on in the business.
Hi, welcome to your listeners. So, Weinberg Medical Physics is a incubator. Now we can call ourselves a venture studio because that term has become more popular these days. But um, our rationale is that we build spin outs and then launch them and generally take equity in them. And these spin outs then um, get more valuable, and that adds value to the shares that we hold in those spinouts. So that's kind of an incubator. Our specialty is in medical imaging and image guided therapy. The reason we adopted this model was because we had done the traditional model of picking a particular technology winner and then raising money, uh, getting the product out, going into the market. It's not a very friendly model to founders. A lot of times, once the venture capitalists come in, the founders often get kicked out. And so we thought that a different model might be to run an incubator, whereby we launch technologies and then recruited um, professionals to run those businesses and C-suites, and then have them go out, talk to investors, and raise money, and then we could move on to the next company. And so that's been our model for about the last decade.
Awesome.
In terms of me, I was initially a physicist, experimental physics, and then I worked for a while as a postdoctoral fellow in medical imaging and decided I wanted to learn more about medicine because I mainly because I wanted to do biomedical engineering, and I thought that this would give me more creative control. And so I went to medical school and then did residency in radiology and nuclear medicine. And I'm still a practicing radiologist. Uh, and we've run these entrepreneurial things for the last 30 years or so. So I know a lot of things to do wrong. And and that's just the way it is in business.
It's easy to find a way to do something wrong, isn't it?
Uh, yeah, we
Yeah.
try to learn from them.
Good,
It,
good, good. Let's give, and you've alluded to some things here. Let's give our listeners a little bit of context about your business structure. At this time, are you solo owner? Do you have business partners? Do you have outside investors, equity people in the business itself?
so the company is organized as a Delaware C corporation. The reason for that was to be able to reward people with options when and
Hmm.
if the company got bought out.
Hmm.
Um, Yeah, we have a few people who have some stock in the company as well,
Hmm.
who had restricted stock or who
Hmm.
decided to exercise their options. But generally, I kind of run it myself. When we spin out a company, that company then has its own leadership structure.
Hmm. Okay. You've mentioned a little bit about that model. To me, that's a really intriguing model. Um, you said you discovered the other one wasn't founder friendly, and I think I've seen that as well from time to time. But how did you arrive at the decision to go this path?
Yeah, I'm not saying it's necessarily even the best thing.
Hmm.
One of the big questions that you're kind of hinting about is how do we pay for people's salaries and stuff?
That too.
And
Yep.
uh, because without investors, how do you keep the lights on?
Hmm.
And we benefited a lot from these small business innovation research grants, or that's the SBIR program or the STTR, Small Business Technology Transfer Research Grants. And so we've been pretty successful at those. I wouldn't call us an SBIR mill, which
Mm.
is a term that sometimes people use in a derogatory fashion
Ah, yeah.
because we've leveraged these grants. So we've gotten about $20 million in grants over the last decade, but
Hmm.
we've leveraged those by getting an additional probably $80 million in investor funding for the various spinouts.
Okay.
So I wouldn't say that we have just, taken the money and used it to, I don't know, nefarious purposes. We've leveraged that money in order to create products and create
Hmm.
companies that help people. Um, so that's what's primarily been funding our progress. We also had some royalties
Mm.
from the spinouts,
Hmm.
and that helped also. Um, I won't say it's the most whether it's the most successful model or not that it could have been. I don't know. I it's just something that we ended up doing. We were successful at getting these grants, and we said, look, let's actually, let's leverage these grants into something that will have some staying power. Because once the grant is over, that's the end of that pipeline. And so we wanted to be good stewards of these federal funds. We've actually had some funding from outside the U.S., including Europe in the past as well. So we decided that we're going to use these to create companies. So that's, I think, how we
Hmm.
bumbled into
Hmm.
this niche. Now, this venture studio concept has uh, come about in the last few years. And the only reason I knew about it was because I was at some conference and somebody said, well, we're putting together this venture studio. And what it is we have particular expertise in this field, and we have some intellectual properties, and we're going to license the intellectual properties to these spinouts. And I said, well, that's what I've been doing. So I guess I'm going to call ourselves a venture studio. So that's what we're doing. We're trying to organize a venture studio fund as well. And hopefully by the time your listeners hear about this, that will have been launched. And we have three companies that we're currently spinning out, and I'd be happy to plug those at some point in the discussion. So you tell me when is the right time to plug them.
Okay, will do. Just kind of going along that track. Do you see yourself as selling devices, or do you see yourself in a way as selling businesses?
Yeah, I'm just basically a gearhead. And so, but I know quite a bit about medicine. And so a lot of times I'm thinking about what would this be useful for? It's very easy for somebody to say, oh, well, I think this would be a great thing for this application. I could say, no, I think that's a really bad idea because everybody's already doing something in a better way. So I look at the need as well as what it is that we can be
Okay.
building.
Hmm.
And my role is limited in the sense that we sometimes people come to us with problems. Sometimes we think of our own problems. Sometimes we have a technology and we say, well, this sounds really good. Maybe this would be good for this. And my role is to build a proof of principle and take that into a product, either get FDA approval for it or help somebody else get FDA approval for it, and then find people who can steer this into a company,
Hmm.
um, and work with them, support them.
Okay, cool, cool. That kind of opens up a different question, or you brought up the word your role. There's a lot of roles in a business, anywhere from marketing to which in your world would probably look more like business development and money soliciting, if you will, grant development. Might also be the designing product designing process, might also be the product producing process, might also be the bean counting process. Where do you see your principal role at this point, yourself, your personal role?
I take out the trash too. So, you just do what you need to do. And we've
Uh-huh.
had people come in and out. We had at one point a, a full-time accountant here. But people come and go,
Hmm.
and you just kind of have to fill in depending on depending on who's there. I remember I worked with somebody, and he said his job was to find people who were smarter than him to do particular tasks. And so certainly I found people who are smarter than me in, um, specific skill sets, and I've been very happy to work with them and to promote them, and wish them well when they move on. So having
Hmm.
done this for 10 years, we've seen, quite a lot of, people, and
Hmm.
some of them end up being professors at universities, and
Hmm.
some of them end up being, CTOs at
Hmm.
startups. Some of them end
Hmm.
up being very good engineers or physicists at large companies.
Hmm.
But we've had a lot of students as well. So, so we see people come in different stages and people leave in different stages of their lives, and it's been fun. Sometimes it's been fun. I've gone to two weddings, of people who've worked here and thought that they just really grew out of their experience.
Awesome. 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 Kind of going down a slightly different track here. What led you to choose going into business in the first place, as opposed to remaining in a research role someplace?
So I've heard that if you're Uh, it's kind of genetic. If you're the child of an entrepreneur, then you end up being an entrepreneur. Now, remember, before Ronald Reagan, people didn't talk about being entrepreneurs. That was kind of he made that term. Yeah, and also I'm just not very good at working in large organizations. I did that,
Hmm.
and just wasn't really good at that. Let me sorry. Um, Yeah, my father was a independent taxi driver, and so he was, and his father before him was had little, little a little store,
Mm.
so it's just kind of an entrepreneurial bent.
Mm. Hmm.
So I wouldn't say it was. I might have done much better in a large company. It's just
Mm.
not really my personality.
Okay. All right. What were you hoping to get out of it on a personal level?
I've been, I've kind of wanted to be a scientist since I was a wee lad, and so to me, it's just kind of been about creative and building things. That's what I did, and fortunately, I married the right woman, who has supported me
Mm.
in this kind of wild and improbable uh, role.
Does it have the feeling of you're working on a project, you're working on a project, you're working on a project, and all of a sudden you or somebody else on the team comes up with a interesting, intriguing, new idea that all of a sudden now you've got to devote some more energy over there?
Well, so the payoff. So I remember talking with somebody, and he said that entrepreneurs have only two emotions: is panic and relief. Um,
Yeah,
but
that might be
to
a
me,
good way to put
the payoff is
it.
I've been in things where we've created something. So we were building an imaging system for the breast. It was a positron emission tomography or PET scanner. It was designed specifically for the breast. So it had very, very high resolution and just was optimized for that. And when we had a patient who was in a clinical trial and we saw a cancer, and it was just because we were using a different way of looking at it, we were looking at um, kind of metabolic activity of the cancer with high resolution. It was the first time anybody had ever seen that. It's the first time
Interesting.
anybody had ever seen that. We were seeing metastases, local metastases that would have been missed with any other modality. So, it was just, it's like, wow, I'm seeing something that nobody's ever seen before. And I've had that privilege a couple of times. So, so, that's the beauty of going into science. It's like making an artwork
Hmm.
and saying, "Wow, that's just really something amazing." And I say that not with some sensitivity towards the
Hmm.
patient. You don't want to just say, "Well, that's a beautiful example of neurofibromatosis or something." There's a person there.
Hmm.
In fact, the person who was the patient is still extremely grateful to me because we found these
Hmm.
satellite tumors that were changing her literally were changing her life. And
Hmm.
as a result of that, she got better therapy. So, but it was still looking at it and seeing something for the first time. It's like, wow, that's what that really looks like. So that's just a really nice, that's kind of people talk about creativity. It's like, well, you have to be a choreographer to be creative or an artist to be creative. But if you're building things, man, it's just such a joy to build
Hmm.
something for the first time and say,
Hmm.
wow, it works.
Yeah. Yeah. The follow-up question to that one might be how many of those devices have been put out into the market so more people can more quickly be diagnosed appropriately?
So our team has built things that have been used by millions of people
Hmm.
and quite a few horses. So one of the companies that we launched, they go by Long Mile Vet, and they have built the standard of care for thoroughbred horses.
Ah,
And yeah, so they're a fun company. They're a fun company.
cool, cool, cool.
Yeah.
What kind of, I want to go back a little bit as I'm sitting thinking about what you've said. How much equity do you keep in these, or do you, over time, sell your equity off as the business grows?
Sometimes I've sold equity just because I thought that the company was going down a wrong path and I just didn't
Mm.
want to be associated with that company.
Yeah, okay, that's fair.
The way it works is that initially you have a lot of equity. You may have 80% at the beginning.
Hmm.
That's the business about a venture studio as opposed to venture capital. So venture capital, they'll come in and take initially 30% of a company and eventually
Hmm.
50% of a company. And a venture studio, because you're really providing the technology, you can justify having a much greater
Hmm.
percentage such that, and that's important because at some point when the company gets diluted, as they all do, you still have a reasonable percentage. So,
So you've got
um,
percentages in several companies right now.
yeah, yeah, and we'll see where they go. We'll
Hmm.
just see. I mean, maybe by the time your your thing is launched, we will see what those companies are worth.
Good, 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 good. This is interesting. This really is a different approach from anybody I've talked to previously.
Yeah, well, I
Um,
don't know if it's a better approach, but it's maybe
well,
different.
I don't know that it is or it isn't. I can
Yeah,
see advantages of it in just what you just talked about is you've got equity is future cash if you wish
yeah.
it to be.
The negative part of it is that if I hand it over to a CEO, now the company's success or failure depends on, how good a steward of the technology that CEO is.
Hmm.
And
Absolutely.
so there are some negative aspects to
There
that.
are risks. Yeah.
Yeah.
Yep. Good. Along this journey, what would you say has been the most memorable hurdle you've had to overcome?
Oh, there's just the hurdles every day. What can I say? The most
Hmm.
memorable hurdle, the most memorable hurdle. You mean the hardest or the most satisfying? Or I
Could
don't
be.
know.
You
There's
could take
just
either way you want to take it.
I don't know. There's just so many hurdles there's just so many hurdles. It's hard to say. There's just so many hurdles. I guess one thing was for me, I think one of the hardest things has been um, managing teams. And I remember we had a story. We had an intern who was I think she was a high school student, and one of the staff members uh, asked her to do something, and it upset one of the other staff members, and so they kind of had a fight about it, and one of them had to leave, and so I picked the one who had been there less time. So
Mm,
it was just a strange experience that I wasn't very good at.
mm.
And so in my old age, now I can say that, um, I've kind of learned that it's important that your team should get along. And although it may be scientifically useful to have them, fight each other, uh, in the long term, um, in the long term, it may not be that productive. So, yeah, so that's one
It's
thing I try to
it's a
learn.
hard call. Yeah. Yeah, good point. Related to that, what's your approach to setting goals, both for the business and for the individuals?
So when I was much younger, I remember I was working in the government, and so we had meetings, and the person who was running it said, "Okay, here's our agenda for the meeting." And I was going, "Wow, that's just so silly. Why would you need an agenda for the meeting? Just, let's just figure this out." And now I'm like Captain Agenda, and because there's just so many things that you have to do. So
Hmm.
so we'll have an agenda listing of about 10 items and say, okay, what progress have we made on this? Who's working
Ah,
on that?
good. Yeah.
So yeah, so there you go.
No, that makes perfect sense to me. Good. Awesome. Taking from there, what's the future look like? Looking out 5 years or 10 years?
Yeah, I remember. I think there was a movie. I think it was called The Intern, and they asked this person who was re-entering the marketplace at the age of, I don't know, 60 something. And said, "What's your 5-year plan?" And he just looked at it, was like, ah,
Yeah, yeah,
uh,
yeah, yeah.
standard question. What's your 5-year plan? So I have particular goals that I would like to accomplish. I'm very interested these days in mental health, and I'd like to transform that field. We have one of our, now I'm going to do the plugs. We have one of our spin outs is a brain health
Hmm.
company that uses image guided um, tomographic neuromodulation.
Hmm.
And there's data showing that a device like this can reverse
Hmm.
dementia, not just slow
Ah,
delay, but actually reverse
interesting.
dementia.
Yeah.
And so we're developing a business model whereby we go to memory care centers,
Hmm.
and rather than have the patients come to the academic center and get this procedure, we just go to the memory care centers and say, okay, here's number one, here's number two, here's number three. So, and we'd like to do that for mental health as well.
Hmm.
Uh, I worked for a very long time in the oncology field,
Hmm.
and so I'm very interested in a breast cancer detection method for rest of
Hmm.
world.
Hmm.
And I know that there's many people who are interested in that, and I've been told by a very large company, if we can make this work, I can just, they'll just pay me whatever I ask for. And I think there's just people just don't think about that. I was talking to
Hmm.
somebody yesterday from Gates Foundation. She said, "Well, we're interested in malaria." And I said, "Well, what about breast cancer detection in Africa?" I said, "Well, no, that's not what we do." So there's basically nobody who's doing it.
Hmm.
And the United States maybe had a limited research role, and that role is getting even smaller and smaller. The U.S. at this point, it's America first, and that's it. But there's a lot of money to be made. There's a lot of people in Africa. There's a lot of people in Asia,
Hmm.
and conventional mammography it barely works in the U.S. It's not going to work in Africa.
Hmm.
So to me, that's a very interesting thing. Some of the technologies that we've developed are going to be useful in dual use. Dual use means that there's military role as well as a civilian role.
Yeah.
And so we're looking at that for directed energy um, weapons and defense kind of electronic countermeasures. So I can't do everything, but I think we can do a lot in one or more of those fields.
How much do you personally get involved in the product development process? How much of that is delegated?
So my role is to just kind of say, oh, just kind of say, well, how's this going? So it's kind of long-term stuff as well as to kind of keep perspective. It's always tempting when you're doing technology development. You know, that's kind of a phrase in medicine is that perfect is the enemy of good.
Hmm.
And so it's always tempting to say, well, why don't we do this? Well, why don't we do that? And so you kind of have to say, okay, we need a product that we can take to FDA in 3 months. And I think that we have a solution that's good enough. Let's just stick to that. And then if we get more funding, we will, we will get this, we will get that better. The
Hmm.
nice thing about FDA, and a lot of people piss at the FDA, but I do not. The people there, they work hard, they want things to succeed.
Hmm.
And and so you can get a product and get it through FDA and then improve on it.
Hmm.
And that's fine. You don't have to go back to FDA unless you made a very significant change in the mechanism of action.
Hmm.
So to me, that's the model. You get a proof of principle, you get it through FDA, and then now you got more money. Let's go and let's make it prettier. Let's paint it. Let's get the patients in faster. And so you're allowed to do continued innovation. Maybe not for drugs. For drugs is trickier because now once you change the drug, you have to go
Hmm.
back to FDA and say, hey, well,
Yeah.
we changed that hydrogen into a nitrogen. Well, that's a new drug. But for devices, it's not like that. If as long
Hmm.
as you're not really changing the mode of the device and you're not changing the risk profile,
Hmm.
the FDA has guidelines saying, okay, well, if you think that you haven't changed it, that's okay. So, so that to me, so my role is a lot of times to say, okay, that's good enough, or
Hmm.
well, this is important because this is going to affect patient safety. So let's get that done first. So we have a very, very capable team,
Hmm.
and so my job is to kind of get the team working in the right, in a productive way.
Just kind of extrapolating from that, one of the thoughts that comes to my mind is if you delegated more of that, would you be able to take on more projects, cover more of those ideas that you're talking about?
Well, that was the reason for thinking about doing this venture studio fund, is
Hmm.
because a lot of times we're just limited by resources, and
Hmm.
these grants are getting harder and harder and harder to get
Hmm.
because of various political things that are going on.
Hmm.
So that's a thought,
Hmm.
but a lot of times the limiting factor is just resources and dollars. Is yeah,
Hmm.
well, yeah, we could hire another two software people, but that would cost another $300,000 a year.
Hmm.
So you have to make some choices.
Hmm. Yeah, priorities. Yeah, cool. All right, let's hit some as we wrap up here. Let's hit some rapid fire questions. So kind of off the cuff, um, immediate thoughts. What would you say is the key to success for you?
Uh, yeah. So I've seen people who've succeeded. I've seen people who haven't succeeded. The
Hmm.
guys who succeeded are the guys or women who work on weekends,
Hmm.
and they're here after I've gone.
Hmm.
You have to have a fire in the belly
Hmm.
to succeed. It's just other people have said this, so I mean that's just kind of what it takes. If you're the kind of person who comes in at 9 and leaves at 5, you just shouldn't do this. You should
You
work
should
for the
have a job.
government. Yeah,
Yeah,
getting a job, right?
yeah, yeah. Good.
And
If
that
you,
may be fine. I'm not
yes,
saying that.
there is nothing wrong with
That
that
may be
solution.
fine. There's
Yeah.
people who paid mortgages, put kids
Yes.
through college, that's
Yeah.
fine.
No, it's a perfectly acceptable path.
Yeah.
Yeah, exactly. If you and I were in a coffee shop and we bumped into somebody that was just in the process of going down a path to start a business or had just started his business, what's one piece of advice you would give them?
It can be very rewarding. That's what I would say is yeah, it can be hard, but it could also be very rewarding.
Hmm. Yeah, and more than just financially.
Yeah. So here's another plug. So my daughter, arielshoshana.com. So she had an entrepreneurial bent, and so
Hmm.
she had this dream. The dream was to have a niche perfume store.
Hmm.
And so she has that. And she has some I don't know, tens of thousands of web followers. And I think they follow her because they like the dream.
Hmm.
They like that.
Hmm.
So and my wife sometimes will pass some place and she goes, yeah, that's some immigrant who has a dream to open some restaurant. And that's the nice thing. So yeah, it's business, but it's also about, what is business? Business is just assigning resources to realizing a dream, realizing a
Hmm.
vision.
Hmm.
So let's kind of keep that in perspective when things get
Hmm.
when things get rough or something. It's like, yeah, it can be rewarding.
Hmm. Reward comes from adversity
Yeah.
and overcoming it. Yeah.
Or your dream or something,
Hmm.
try it.
Hmm.
Try it. If it doesn't work, it's okay. I've had, I don't know, probably a dozen different careers in my
Yeah.
life.
Hmm.
So that's okay. It's good to keep trying things, keeps the brain fresh.
Yeah. Yeah. Start over if you don't like the results of what you're doing, start over. Do something different. Cool. What's a book you're reading now or have read recently that's had impact on what you're doing?
Wow. Uh, so somebody referred me to this book called Valley Boy
Oh.
by by Perkins, and the guy seems quite obnoxious, but uh, but um, but he's got some insights, and
Hmm.
obviously a very brilliant guy. So they
Hmm.
they were the venture firm that backed Google and Genentech.
Hmm.
Um, so I mean, you do that once, you're lucky. Hey,
Hmm.
you do it 10 times, it's not luck anymore. It's just
No,
you gotta
no,
you
you've
gotta be
learned
pretty
something.
you gotta be pretty smart. So that's the book that I'm in the middle of reading.
Okay, cool. You've had a really interesting journey here um, through business and tried a lot of different things and approaching some things differently than some people do. What are you most proud of in that journey?
Yeah, I've saved some people's lives.
Hmm.
That's what I'm at. Like I said, I still practice I have a funny practice as a radiologist. I talk with patients and go over the scans with them. It's called virtual physical,
Hmm.
and it's a very interesting and rewarding experience to have to work with the patient and come up with insights that help the patient and sometimes save lives.
Hmm.
And we've saved lives professionally as well. So I don't know that. So I did my internship at a community hospital, and I was talking to this nurse. So this is about, I don't know, 40 years ago. And she was working really, really hard. And I asked her, "Why are you doing this? Why are you doing this?" And she goes, "To heal the sick."
Hmm.
That was her quick response.
Hmm.
So, it's a good thing.
Hmm. Helping people.
Yeah,
Yeah,
helping
good.
people and being creative. Like for me, creativity is really that's really fun.
Hmm. Hmm. Creating using science.
Yeah. Like Iron Man, right? You get all the
Hmm.
soldering tools in there and just,
Hmm.
build something that helps
Make
somebody.
make something that has never been done before. Yeah, good. Following up on the flip side of that, if you had a magic wand and you could magically improve something in your business this afternoon, what would it be?
Well, it'd be nice to have more funding. That's always nice.
Hmm. Hmm.
So that would be good.
Okay, good. Most important question, how can
What's
people
my
who would,
favorite color?
no, we're going to skip that
No?
one.
Skip that one. Okay. All right.
Yes, that's a
Silver.
fair, yeah, it's a
Silver.
different,
That's my
yeah,
favorite color. Okay.
yeah. How can people who want to get to know more connect with you?
Yeah. So, uh, so my email address is inweinberg@gmail.com. And yeah, that's fine. You can contact us there, or you can find us. You can find me on LinkedIn. There's not too many Irving Weinbergs on
Mm,
LinkedIn, so can find us there.
awesome,
Yeah.
awesome. Last question. What's most inspiring to you today?
What is or who is
Hmm.
or
Either one.
so I've visited a lot of places um, that resemble I imagine what New York was in the 1920s or something when they were
Mm.
building the Brooklyn Bridge and just having big visions. And for example, Shanghai, Shenzhen, um, Bangalore in India. It's just really nice to see, a lot of young people really working hard and feeling that it's gonna pay off.
Hmm.
Um, so I really like being immersed in those environments.
Fantastic, fantastic. Very interesting. Yeah, I have been to Shanghai. I have not been to Bangalore. Interesting. Yeah, Shanghai was
Well,
a very dynamic place when I was there.
it's very dynamic. In
Hmm.
Shenzhen, the motto of Shenzhen is "In science we trust."
Hmm.
Um, and that's useful. In Bangalore, at least when I was there, you're coming out of this little country dusty road with talks on it, and all of a sudden you're in this super highway. So yeah, these guys work hard. They work
Hmm.
hard and they expect it's going to pay off.
Hmm.
So I haven't lived in Northern California. We had a company that we spun out that moved out there, and that's kind of like that in a way. It's just kind of opportunity.
Hmm.
People believe in opportunity, and
Hmm.
that's that's fun.
Hmm. Awesome, awesome. This has been a great conversation. It's been a good story, and I've enjoyed hearing you sharing it. Thank you very
All
much for
right.
sharing this. This is good.
All
For the
right.
audience, I encourage all of you watching to save the show, come back and watch it again. Irving shared a couple of good uh, insights into business, and he's taken a whole different strategy than most businesses take, and approaching it a little bit differently. So don't forget to like and subscribe to the channel so you can get some notifications when we drop a different conversation like this. So thank you to everyone who joined us today, and a special thank you to you, Irving, for being with us and sharing your story.
All right. Live long and prosper.
Very good. I like that.
Okay. Okay. Bye.
Bye.